Thank you, Honourable Speaker. Thank you, Honourable Member, for that wonderful question. I'd like to say good morning and also Malo Peter and good morning to our colleagues from Tonga. Honourable Speaker, in 2014, government had 431 doctors. Now there are 804 doctors. A significant increase of 373. This indicates the number of doctors recruited, Honourable Speaker, has almost doubled in the last 5 years. The majority of these doctors are our children, our local graduates from the two universities. And there are now more students still studying medicine and will continue to study medicine, which consequently increases the Ministry of Civil Services intakes of our local interns who will then, after their probationary period, and they pass, become doctors. Our current establishment, Honourable Speaker, shows that we have a total number of filled positions at 804. The total number of positions is 960, with a total number of vacancies at 159. We have, as we speak, internal promotions that will be affected in this month that will also affect numbers, and these are up to 40, which is in the senior medical officers, principal medical officers, chief medical officers, and 2 consultant positions. We've also made recruitment from overseas and outside the civil service, and these, when I say outside the civil service, these are doctors working in the private sector, or possibly from the university, coming back in to supplement our numbers, given the working conditions that have improved dramatically, which I'll talk about a little bit later. And these are medical officers 19, senior medical officers 7, principal medical officers 3, chief medical officers 3, with a total of 32. Honourable Speaker, the increase in doctors is largely due to an improved recruitment process under the Fiji First government, and also recently under the Open Merit Recruitment Selection Guideline implemented since 2016. The improved working conditions and the use of modern and far-reaching advertising and advocacy platforms have also helped us in our recruitment process. Most of this recruitment was undertaken over the last 4 years, but significantly also over the last 2 years. Honourable Speaker, when we talk about numbers of doctors, it is important to understand that what we are talking about is the numbers of doctors that we train, the numbers of doctors that remain within the system, and also, more importantly, what is the attrition rate. Honourable Speaker, there was a very significant attrition of doctors from the civil service for a very long time. And to discuss doctors' numbers, one must understand the background and the efforts of this government to retain doctors. Honourable Speaker, the late Dr. Salimoni Tunga prepared a cabinet paper in 2000. I'm not sure whether it was presented or not, but I was privy to see that paper that showed that 70% of all doctors in the civil service from 1987 to 1999 left the civil service, with the majority going abroad. And when I say majority going abroad, it brings to mind a statement once made by Sir Terapaya Moate, the Deputy Prime Minister of Cook Islands, the late Sir Terapaya Moate, in which he said that we in the Pacific should push for a brain rotation rather than a brain drain, which means if people leave the service, as long as they leave but will remain within the country or remain within the Pacific. These doctors never stayed in the Pacific. They left for greener pastures elsewhere into the modern countries that we talk of. These sentiments were echoed in some other studies, and the attrition rate continued into the early part of 2000s. I will give you some examples, Honourable Speaker. My graduating class of 1996 of 14, last year, one was employed back into the service, now has only 2. From the 14, only 2 remain in the service. The class, the next year, in 1997, there's only 2 left in the civil service. The class of 1998, I believe, I've checked around, unless there's 1 left, there's none left in the service. None. Whole classes of doctors graduating within 10 to 20 years were leaving in droves for overseas, predominantly, then also into the private practice locally. We have, Honorable Speaker, estimated more than 100 specialists of Fijian origin in Australasia alone. 100, Honorable Speaker, who could be here supporting the work that we do. Honorable Speaker, Kimberly Oman, in a thesis at James Cook University, and I'm not sure whether it was a master's or PhD thesis, published in 2007, looking at the reasons why doctors and specialists migrate, are similar to the reasons that the late Dr. Tunga talked about in his paper. And these are four. Number one is political instability. Number two is the lack of recognition. Number three is the lack of career pathways. Number four is the lack of transparency and promotion. And with the lack of recognition in two was obviously the appropriate working condition. Honorable Speaker, the Bainimarama government slowly began to implement changes, not only to increase doctors' position, but to retain doctors. Since 2006, small increases in establishments were done, especially at the top, in diverging the pyramidal shape of the establishment and the recognition of our young growing cohort of specialists, and I'm proud to say that I was one of them. Honorable Speaker, the regularization was also done to recognize those acting for more than 1 or 2 years. And this saw some of our young doctors doing very senior tasks with appropriate qualifications being awarded on the spot of the position. And some of them actually were promoted 2 or 3 times above the levels that they were on because they had the apparent qualification and were acting for a very long time. Honorable Speaker, the most significant change came in the 2017-2018 budget announcement. The salaries increased, doctor salary from 57% to 84%, and was weighted according to the clinical demand of their on-call commitment. Honorable Speaker, I was invited to listen as President of Fiji Medical Association in the tea room, and I was hopeful and wishing that day that something would happen. When the Minister of Economy called it, tears were shed all over the more than 100 facilities in Fiji that night that doctors were manning and at their homes for those resting. In addition, Honorable Speaker, this government, the Fiji First government, also increased significantly the salaries again with the open merit recruitment system, and through this initiative allowed our young learned doctors to compete for positions that in the old system would be out of their reach. This also meant another increase in salaries, with some doctors, Honorable Speaker, in total having nearly 100% increase in salary within a year. This is the only government that takes care and protects its doctors and walks the talk. Honorable Speaker, the World Health Organization minimum standard is 1 doctor to 1,000 of the population. And I'm pleased to inform this August House that with the establishment of more than 800 of field positions, not including those that haven't been filled, we have crossed that threshold. What this government through the Minister of Civil Service and the Minister of Health has begun to implement is the right amount of hours acceptable and safe for both the doctors and the community. Honorable Speaker, not long ago, at the turn of the century, we would work 36 hours straight without rest. My children and many doctors' children aversion to medicine is because of these long hours at work and exhausted moms and dads who could not contribute to their upbringing. Honorable Speaker, we worked in sleep-deprived stupor, and personally on many occasions I would ask my wife in the morning, literally, my dear, what day is it? Honorable Speaker, the implementation recently of work-corrected hours and the fact that we have a surge in the acute clinical load in all our facilities may seem to suggest we do not have enough doctors. And this policy of work-corrected hours has been implemented as of recent as a result of a joint review that considered the doctor-patient ratio and determined that doctors' working hours could now be changed because we have the numbers. Yesterday in the evening, there were 7 doctors when we left here in Valley Level Health Center and still 100 patients to be seen. And they were working hard to see that all patients were going to be seen before they left for home. Honorable Speaker, the surge of recent seems to be acute viral illness, and this is also tipping off the chronic cases such as asthma and those with NCDs. These illnesses, Honorable Speaker, has also been reported elsewhere, and we ask all Fijians to utilize our facilities as much as possible during off-peak hours when we have large numbers of doctors available. I ask this noble House that we be proactive and ask all Fijians to be wary of their health, be precautionary, eat healthy, exercise and rest well. Honorable Speaker, the Ministry of Civil Service conducted bulk recruitment processes that utilize local advertising and international publication through a professional social networking site. This has attracted senior and experienced doctors from far away Scandinavia, and she's working here today to apply for roles we've been unable to fill previously. And because our working conditions and the salaries are competitive, we are able to attract them. Also, a classmate of mine who has been able to come back from overseas is now the subdivision medical officer in Vunindau, sharing his overwhelming experience from his exposures in Africa with overseas agencies and championing our fight against typhoid in Naitasiri. Honorable Speaker, I'm proud to say that I've heard that as of recent, a gentleman from Nambombudho in Naitasiri, trained in New Zealand and graduated with a fellowship in surgery, has accepted a consultant role in surgery in CWM Hospital, the position I formerly had, as the salary is competitive and allows him to come back and serve Fijians and look after his aging mother. Honorable Speaker, we also have a growing number of former Fiji citizens who are specialists overseas, returning and offering their expertise. This is unprecedented. There are ongoing discussions with both the Ministry of Health, Medical Services and the Ministry of Civil Service and the universities on how we can better address the recruitment process moving forward. This, Honorable Speaker, sir, will also ensure the introduction of measures that will not only give new graduates an opportunity to showcase themselves, but also providing an opportunity for registration purposes to the new doctors, the interns. This platform will subsequently improve the Ministry of Civil Service, a safety net to select its best candidates at the end of each phase. Honorable Speaker, as I finish, I bring us back to Kimberly Oman's and Dr. Tunga's findings of why doctors leave. Political instability, we are now stable. Lack of recognition, they are now recognized and paid well. Lack of career pathways, they have many. Lack of transparency in promotion, we now have open merit recruitment. These are all being met by the Fiji First government, resulting in our significant numbers of doctors. Thank you very much, Honorable Speaker. Thank you for the question.